Good morning, good afternoon, it's afternoon. I wanted to start part 2 of the SOGI series, the SOGI 123 sex ed curriculum for schools, which basically stands for sexual orientation and gender identity. And so far we've discussed the negative views on it from other people, and I've expressed a few myself, things I didn't like and the things I did like. Today I'd like to talk about puberty, okay? This video basically is why it's so important for children to go through puberty. And giving them puberty blockers is going to prevent them from going through that, which is a much needed thing for our emotional, our psychological, our physical and sexual development. That all goes through your none of those things till you've gone through puberty, okay? Okay, I'm not saying you can't have sex before puberty, I'm just saying that sexually you find out who you are and whether you're comfortable in your body or not. Look, I have no problem with children being transgender, okay? You can live your whole life that way. I lived over 40 years knowing I was transgender, and just now started getting in my surgery, right? So I'm not saying children can't express themselves. That's not my issue at all. My issue is them giving puberty blockers to children, even very young children that shouldn't have them. Yet they claim it's only the 11s and 13-year-olds, but I think they've actually gone before that from what I've heard from other people. Now I don't know if that's fear-mongering or what. There's no medical proof to back it up, but still, I believe people when they say that they've heard of kids younger than 11 getting puberty blockers, and I find that disturbing, especially for the medical community, because basically they don't know the effects of these drugs long term. And you know, when you're looking at a child having puberty blockers, say from the age of, we'll say 9 until they're 16 or whatever when they get their surgery, that's a lot of years of taking the puberty blockers. Now, not only does it block your puberty and it blocks your body's natural development cycle, it really is a negative when they don't know what they're doing, okay? They don't know what the effects will be. All they know is that they can give them to you and you won't die. That's basically all they know, okay? And they know what the effects of the pills are, but other than that, they don't know. This is like one study, and everyone doing them right now are guinea pigs. Understand this, okay? Watch this quick video, and I'll be right back.
Between childhood and adulthood, our hormones kickstart a phase of significant change. And while the physical changes of adolescence may be obvious, less visible are changes that these hormones trigger in our brains, which might just be responsible for turning our teenage years into a bit of a roller coaster. Throughout our lives, our brains undergo a process called neural pruning. The synapses through which our neurons communicate are either lost or strengthened, depending on how much we use them. Well-used synapses grow strong, while the weaker ones fade away. It's this process that makes us capable of faster, clearer, and more complex thought as we grow up. But, crucially, pruning happens at different rates in different areas of the brain. By the time we're adolescents, the neural networks that communicate emotion, risk and reward are well developed, while others, which may help us to plan, prioritise, think logically, and moderate our social behaviour, are yet to mature. So, a potential mismatch between our emotion and our judgment arises just as our emotional and social worlds are becoming more complex, making an increase in social anxiety quite normal at this time. Researchers at the University of Oxford want to know how this might affect our behaviour as we progress through our teenage years. In a recent study, they focused on the social worries many of us feel as adolescents. When presented with photographs of ambiguous social scenes and asked to imagine themselves in the picture, anxious younger teens were more likely than others to perceive negativity. But while these heightened emotions and the struggle to control them can make adolescence a difficult time for some, the adolescent brain is particularly agile and flexible, and as such, it's especially open to new opportunities, new technologies, and new experiences. So while our teenage years may feel pretty weird, they're also pretty wonderful. To explore how your brain develops, visit www.oxfordsparks.ox.ac.uk.
Well, you can see from the medical community, it's not good to not go through puberty, okay? I feel it's more of a detriment than actually doing the pills, the puberty blocker pills. It really annoys me that they're doing this without knowing the long-term damage, and I think if a lot more parents thought about it, they might, wait and just let the child go through puberty. It's very important for surgery as well. And Jazz found that out when she did her show, that she didn't have enough material to work with because she didn't go through puberty, right? And, there might be advantages to not going through puberty. I see more disadvantage than I do advantages, okay? The psychological and emotional makeup of a person really develops when they go through puberty, and that's a really important thing. But you got to consider the fact that a lot of people are going ahead and trying this right now, and their kids are guinea pigs, and that bothers me a lot. Why can't they just express as trans, whichever sex they feel they are, until they are of age to do the HRT drugs, instead of having to do the puberty blockers, right? It really makes no sense to me why they're doing this. And like I said, kids are very impressionable, and you could easily make a child think that they are transgender just by suggesting it. And it's, something that should be spent a lot more psychological evaluation on the children before they just go ahead and, give them the blockers and stuff, right? I don't know, it really bothers me, and that's why I'm doing this video series. There's other things that bother me too. I'll be getting to in part 3. And maybe even part 4, I have to go that far. But basically, folks, it's not good, okay? I'm seeing this as a bad experiment. So watch this video footage.
I'd like to introduce Dr. Norm Spack, pediatric endocrinology. He's sort of the founder of pediatric endocrinology, transgender healthcare for adolescents in the United States.
So basically, Norm Spack is, I guess, the godfather of endocrinology or whatever. He has taught a lot of these doctors about endocrinology and the changing of sexual organs and stuff.
It was based on what they started doing in Amsterdam in treating trans youth in the Dutch protocol, which became the current standards of care.
So the Dutch became the standard of basic care and level of care for trans people. They are also the ones who started transitioning kids before puberty, and this is kind of what's really concerning me. And I know they have their reasons, but I guess I just see things differently than they do. Watch this.
Now in the Netherlands, they were talking to adult transgender people, and they were hearing about their stories, their lives, and hearing from them that adolescence was so difficult for them because they were watching their bodies take off in the wrong direction, go through the wrong puberty, develop the wrong secondary sex characteristics. That increased their anxiety and depression, but it also caused them to struggle in terms of trying to hide those secondary sex characteristics now as an adult. It made their lives more difficult, and a lot of them were expressing the fact that they felt like the very first thing that anyone thought when they saw them was, that's a transgender person. That's not the very first thing that they wanted someone to think when they saw them. So in the Netherlands, they said, this is a tricky problem because puberty starts when you're like 10, 11 years old, not the ideal age to be making decisions about anything, much less making a medical transition. So that became the sort of the conundrum. They're similar for children coming into our clinic, and then the question becomes, could a medical transition be helpful with the goals of reducing distress and dysphoria, improving quality of life, and reducing psychiatric comorbidity?
So basically, what I worry about is that adolescence is the period of physical, cognitive, and social maturation between childhood and adulthood. It plays a large role in forming the person each person is when they go through adolescence. beginning of adolescence occurs at the onset of puberty and is therefore marked by dramatic changes in hormone levels, physical appearance, including rapid physical growth, changes in facial structure, and sexual characteristics. Adolescence experiences numerous changes in social, academic, and brain function and other environmental influences. Like basically what they're saying is puberty is needed. It's not just something you can option out puberty. Puberty is a big part of making each person who they are, and I think blocking puberty is going to cause problems with these children, and actually is going to possibly limit who they are or would have been if they had gone through puberty. I just have issues with this, and I'm not saying kids can't be trans and dress as what they see themselves, like who they feel they are. I mean, express yourself, no problem, but going through the drugs and avoiding puberty and then going through the whole HRT thing with the estrogen levels and all that stuff. I mean, the younger people seem to take the estrogen medication a lot harder. I myself, have had no problems with it, but other people, get depression and various other, drug addictions from it. They get, suicidal thoughts. These are all things that you can experience when you're changing your body function, like the body makeup from, say, testosterone to estrogen and then vice versa, right? They're pushing a lot of drugs in your system, and it can really play a role on your brain, okay? If you're not mentally able to handle what the transition involves, then you're going to be at risk to be one of those who fall into the suicide part. Look, I'm going to discuss more in part 3 and 4. Right now I just wanted to do the puberty part in this video today, to make people understand, or at least give them the option to look into puberty a little more. This whole transitioning children thing is new, so there's not a lot of videos and information on the subject, and most of them are either pro or against. There's no nonpartisan views on the transgendering of children. It's really hard to find information on that, simply because you're either right or left, so to speak. But look, in my opinion, children should not be transgendered until they have reached an age that at least it'll be safe to start them on the medication to see if they have reactions to it or not. But we don't want more children falling into the suicide trap that runs along with being transgender. It doesn't make your life all better just because you're transgender. I mean, it makes your life harder, okay? I can tell you that, personally. But, I'm not saying it's a bad thing. If you're not the sex that you were born, then, yeah, you definitely want to transition, and I fully understand that. But transitioning children is just not the way to go. They're going to find this out when it's too late. So anyway, watch this video footage.
The question is, I mentioned that patients would come and have a psychosocial and gender assessment. And what is a gender assessment? So that's a really good question. Different clinicians think of a gender assessment as different things. Some use tools like scales where they're trying to quantify gender and gender dysphoria. However, our clinicians use one scale, and they also just talk a lot with the client about their gender history, getting a sense for things like, when did they, getting a sense from the parents about what they noticed as when they were a young child, what their memories of early childhood were, what their experiences with puberty have been, if puberty has happened, and getting sort of a comprehensive look at gender in all of those different contexts. So it's more of a talk assessment than a pen and paper assessment.
Basically, as you can see, their gender assessment procedures seem rather quick. They don't stress enough on how long these people are assessed. It's almost like with that show, Lost in Transition, how the guy just walked in and he was able to blow through a 20-minute interview with his secretary, and he was in the endocrinologist office. 3 questions and he had an offer for his drugs, his needles, right? And it almost seems like they're doing the same thing with these children. Okay, you're transgender, okay, so one quick talk and here's your drugs, right? Here's your puberty blockers. And that's kind of what I'm afraid of with this whole SOGI program. The point is that they are not only encouraging people to turn trans kids, but they're also encouraging a speedy delivery of the drug system. And I really still feel in my heart that stopping the puberty is actually limiting who they can be, because when you go through puberty, all that is decided, and all of that is it's basically, you know, your sexual person, your emotional person, your physical person, and your social development, and all those things round off in the time of adolescence. And if they're stopping adolescence, then they're actually stopping these kids from finding out who they are. And I understand the whole part of going through that awkward stages and being afraid of going through the whole puberty thing, but I really think for physical reasons that it's important. I also think that these drugs could have a stronger impact in the long run if they are blocking puberty, and they just really don't know what the long-term effects of these drugs are going to be, and I really think that they're jumping the gun here to transgender children, and I think really there should be age limits set on when they can start getting drugs, and I really disagree with the puberty blockers, and I can't stress that enough. That's my own personal opinion. You can feel how you want about it. But to me, I see this as child abuse. If that child is not specifically transgender, and even if they are, why can't they wait until they hit the puberty stage and then start taking the HRT, right? They say puberty at 10 and 11, and yeah, it starts at that point, but very slowly. I mean, you know, some kids faster than others, but I still think blocking puberty is damaging them. And if you look at the trans suicide rate, it's still over 60% in adults. So how is it going to be with the children? And that's kind of what I'm worried about. And we're not going to find out about that for years to come yet. So I have my doubts about this whole thing, and like I said, that's my right to have my opinion, and you have your right to your opinions, but I see this as a big mistake. It's the end of this video. I hope you all have an awesome day, and we'll see you in part 3.